The treatment of varicose veins early on is important because the more advanced they become, the more symptomatic and the more difficult it is to treat. So you're not necessarily just treating the varicose veins at that point, but you might also have to deal with the complications that they have caused as well. Varicose veins can be symptomatic or asymptomatic, meaning they cause symptoms or not. In some patients, they could become inflamed, and the inflammation could cause discomfort. That could happen at times where you're standing for long periods of time, where there is increased pressure on the veins and on the legs. And in certain areas, such as hemorrhoids or varicose veins around the esophagus, they could even bleed at times of increased pressure. Therefore, they should be treated because in certain situations, the bleeding can be dangerous, such as around the esophagus. You could have an upper gastric bleed, which could lead to a lot of blood loss. On the legs, they generally don't tend to be as dangerous. However, they can be a sign of poor venous vasculature of the legs, and that can have other side effects, such as leading to breakdown of the skin, which we call venous ulcers, and that essentially causes sores on the skin, which can get infected. They could also be very painful and should be treated. We have some excellent treatment options available for patients with varicose veins, and I would just recommend that if somebody notices that they're starting to develop them, to start wearing compression stockings and also seek the care of your physician, your dermatologist, or a vein specialist, because there are many treatment options that we have that could help to prevent and to treat varicose veins and any complications related to varicose veins.